Good day, everyone. Today, we'll discuss chronic kidney injury, also commonly known as chronic kidney disease, or CKD. This condition is very important in nursing because it affects multiple body systems and requires long-term management and patient education. Chronic kidney injury is the progressive and irreversible loss of kidney structure and function that occurs over a period of 3 months or longer. The kidneys are responsible for filtering waste products from the blood, maintaining fluid and electrolyte balance, regulating blood pressure, producing erythropoietin for red blood cell production, activating vitamin D for bone health. When kidney function gradually declines, these processes become impaired, leading to serious complications. According to KDIGO guidelines, chronic kidney injury is diagnosed when there are markers of kidney damage, or the glomerular filtration rate, or GFR, is less than 60 milliliters per minute per 1.73 square meters, and these abnormalities persist for 3 months or more. A reduced GFR means the kidneys are no longer filtering blood effectively. Clinical features. Patients with CKD may initially be asymptomatic, but symptoms develop as kidney function worsens. Common clinical manifestations include fatigue and weakness, edema or swelling, changes in urination, hypertension, nausea and poor appetite, muscle cramps, difficulty concentrating, and sleep disturbances. These occur because toxins and fluids accumulate in the body. Common causes. Now, let's discuss the common causes of chronic kidney injury. 1. Diabetes mellitus. This is the leading cause. High blood sugar damages the tiny blood vessels in the kidneys, reducing filtration ability. 2. Hypertension. Persistent high blood pressure damages renal blood vessels and nephrons over time. 3. Glomerulonephritis. Inflammation of the glomeruli causes scarring and decreased kidney function. 4. Long-term use of nephrotoxic drugs. Examples include NSAIDs and certain antibiotics that may injure kidney tissue. 5. Chronic urinary obstruction. Conditions like kidney stones or enlarged prostate can block urine flow and damage the kidneys. 6. Polycystic kidney disease. A hereditary condition where multiple cysts develop in the kidneys. Complications. If untreated, chronic kidney injury may lead to severe complications. Cardiovascular disease. CKD increases the risk of heart attack, stroke, and heart failure. Anemia, due to decreased erythropoietin production. Bone disorders. Impaired vitamin D activation affects calcium and phosphate balance. Metabolic acidosis. The kidneys cannot eliminate excess acids. Increased risk of infection. End-stage renal disease, or ESRD. At this stage, dialysis or kidney transplantation becomes necessary. Management focuses on slowing disease progression and preventing complications. 1. Treat the underlying cause, control diabetes and hypertension. 2. Blood pressure control. ACE inhibitors, or ARBs, are commonly used. 3. Glycemic control. Maintaining blood sugar levels prevents further kidney damage. 4. Dietary management. Patients may require low-sodium diet, controlled protein intake, potassium and phosphorus restrictions. Avoid nephrotoxic substances such as NSAIDs and contrast dyes. 6. Lifestyle modifications, including exercise, smoking cessation, and weight management. Pathophysiology. Let's move to the pathophysiology. The disease process begins with sustained injury to the kidneys. This may result from hypertension, diabetes, toxins, or inflammation. This leads to nephron damage and loss. Nephrons are the functional units of the kidney responsible for filtration. As more nephrons are damaged, glomerulosclerosis and tubulointerstitial fibrosis occur. This means scarring develops in kidney tissues. Because of this, GFR decreases. The kidneys can no longer effectively remove waste products and excess fluids. Eventually, progressive decline in kidney function occurs. This damage is usually irreversible. Signs and symptoms of chronic kidney injury. Fatigue and weakness. One of the most common symptoms is fatigue and weakness. Patients often feel tired because waste products accumulate in the blood. Anemia develops due to decreased erythropoietin production. Electrolyte imbalance affects muscle and nerve function. As nurses, we should assess the patient's energy level and monitor laboratory results, such as hemoglobin and hematocrit. 2. Pale skin. Patients with CKD may develop pale skin. This happens because damaged kidneys produce less erythropoietin, a hormone responsible for stimulating red blood cell production. As a result, anemia occurs, causing pallor, weakness, and dizziness. 3. Nausea, vomiting, and poor appetite. Another common manifestation is nausea, vomiting, loss of appetite. This occurs because toxic waste products, also called uremic toxins, build up in the bloodstream and irritate the gastrointestinal tract. Patients may also experience weight loss and malnutrition. 4. Itching or pruritus. Patients may complain of persistent itching. This is caused by accumulation of waste products in the blood, dry skin, elevated phosphorus levels. Itching can significantly affect sleep and quality of life. 5. Changes in urination. Changes in urination are important signs of kidney dysfunction. Examples include increased urination, especially at night, decreased urine output, foamy or bubbly urine due to proteinuria, dark-colored urine. As nurses, monitoring intake and output is essential in assessing kidney function. 6. Muscle cramps. Muscle cramps may occur because of electrolyte imbalance, particularly abnormalities in calcium, potassium, phosphorus. These imbalances affect muscle contraction and nerve conduction. 7. Swelling or edema. Patients may develop swelling in the feet, ankles, legs, face, around the eyes. This happens because the kidneys cannot properly remove excess fluid from the body. Edema is an important sign of fluid retention. 8. Difficulty concentrating. As toxins accumulate in the bloodstream, they can affect brain function. Patients may experience poor concentration, confusion, memory problems, sleep disturbances. Severe cases may progress to altered mental status. 9. High blood pressure. The kidneys help regulate blood pressure. When kidney function declines, fluid retention increases. Hormonal regulation becomes abnormal. This causes or worsens hypertension, which can further damage the kidneys, creating a vicious cycle. 10. Unexplained weight gain. Rapid or unexplained weight gain may occur due to fluid retention. This is why daily weight monitoring is very important in CKD patients. Sudden increases may indicate worsening fluid overload. Other possible signs. Other symptoms may include shortness of breath, metallic taste in the mouth, dry skin, headache, sleep disturbances. Shortness of breath may occur because fluid accumulates in the lungs. Nursing implications. As nurses, our responsibilities include monitoring vital signs and fluid status, assessing edema and respiratory status, monitoring intake and output, educating patients about diet and medications, encouraging regular follow-up and laboratory monitoring, promoting early detection of complications. Patient education is important because early management can slow disease progression. Nursing interventions for chronic kidney injury. The main goal of nursing care in CKD is to slow the progression of kidney damage, manage complications, maintain fluid and electrolyte balance, promote optimal nutrition, improve the patient's quality of life. Let us go through each nursing intervention shown in the infographic. 1. Assessment and monitoring. The first and one of the most important nursing responsibilities is proper assessment and monitoring. Nurses should monitor vital signs, especially blood pressure, assess daily weight, monitor intake and output, or I and O, observe for edema or fluid retention, assess for fatigue, dyspnea, nausea, and itching urine characteristics, such as color amount, Specific gravity should also be monitored carefully. Daily weight is very important because sudden weight gain may indicate fluid overload. Laboratory monitoring includes BUN, creatinine, eGFR, electrolytes, hemoglobin, and hematocrit. These tests help evaluate kidney function and detect complications early. 2. Blood pressure. Management hypertension. Both causes and worsens chronic kidney injury. Nursing interventions include monitoring blood pressure regularly, administering antihypertensive medications as prescribed, encouraging medication adherence, promoting a low-sodium diet. ACE inhibitors and ARBs are commonly prescribed because they help protect kidney function. Patients should also be taught how to monitor their blood pressure at home. The usual target blood pressure is less than 130/80 millimeters of mercury, depending on physician orders. 3. Fluid and electrolyte management. The kidneys regulate fluid and electrolyte balance, so this becomes impaired in CKD. Nursing care includes accurate monitoring of intake and output, fluid restriction if ordered, assessing for edema, crackles, and jugular vein distension. Electrolyte monitoring is essential, especially potassium, sodium, calcium. Phosphorus hyperkalemia is particularly dangerous because it can cause cardiac arrhythmias. Patients should also be educated about signs of imbalance such as muscle weakness, confusion, palpitations, muscle cramps. 4. Nutritional management. Dietary management is an important part of CKD care. Nurses collaborate with dietitians to provide individualized meal plans. The diet may include low sodium, low potassium, low phosphorus controlled protein intake. Adequate calories should still be maintained to prevent malnutrition. Patients should also monitor fluid intake as prescribed. 5. Medication management. Patients with CKD often take multiple medications. Nursing responsibilities include administering medications safely, monitoring for side effects, adjusting medication doses based on kidney function. Common medications include antihypertensives, phosphate binders, sodium bicarbonate, iron supplements, vitamin D analogs, diuretics. Nurses should also avoid nephrotoxic drugs, such as NSAIDs, whenever possible. 6. Preventing infection. CKD patients are more vulnerable to infection because of weakened immunity. Nursing interventions include practicing proper hand hygiene, monitoring for signs of infection, maintaining aseptic technique, encouraging vaccination such as influenza vaccine, hepatitis B vaccine, pneumococcal vaccine. Patients receiving dialysis require especially careful infection monitoring. 7. Promoting elimination. Constipation is common in CKD patients due to fluid restriction and medications. Nurses should monitor bowel patterns, encourage appropriate fiber intake if allowed, administer stool softeners as ordered. Uremic symptoms such as nausea and vomiting should also be monitored. 8. Patient education. Patient education is one of the most important nursing roles. Teach patients about their disease condition, medication adherence, dietary restrictions, fluid restriction, avoiding nephrotoxic substances. Patients should also learn early warning signs that require medical attention, including swelling, shortness of breath, decreased urine output, chest pain, confusion. Lifestyle modifications such as smoking cessation and exercise should also be encouraged. 9. Psychosocial support. Living with CKD can affect emotional and mental health. Patients may experience anxiety, depression, fear, body image concerns. Nurses should provide emotional support, encourage family involvement, promote support groups, refer patients to counselors or social workers if needed. Holistic care includes both physical and emotional well-being. 10. Preparation for renal replacement therapy. In advanced CKD, patients may require hemodialysis, peritoneal dialysis, kidney transplantation. Nursing responsibilities include explaining treatment options, preparing vascular access, teaching dialysis schedules and care, supporting decision-making and advanced care planning. Education helps reduce fear and improve treatment compliance. When to notify the healthcare provider, nurses should immediately report sudden weight gain, decreased urine output, persistent nausea or vomiting, shortness of breath, chest pain, confusion, abnormal laboratory results. Early reporting can prevent serious complications. Conclusion. To summarize, nursing management of chronic kidney injury focuses on slowing disease progression, managing complications, educating patients, supporting physical and emotional health. Through proper assessment, monitoring, education, and compassionate care, nurses play a major role in improving outcomes and quality of life for patients with CKD. Thank you, and that concludes our discussion on nursing interventions for chronic kidney injury.